Good morning. We're going to start in just a moment. We have to go through and give each of you individual recording privileges. So we'll do that. We're working through that. We'll do that in just a moment. Again, for folks who've just joined us, good morning. Thank you for joining us. This is the Hospital Association media briefing, and we will start shortly. We have to go through and give each of you recording privileges.
And we're good on my end.
Great. Cindy, did you have some to, is everybody granted, Brian?
Yeah, I'm good.
Okay.
Oh, perfect.
Great. Thank you. Okay. All right, great. Thank you all so much for joining us today. I'm Cassie Sauer. I'm the CEO of the Washington State Hospital Association, and we're pleased to have you. We've got panelists from around the state today that we're really pleased to have. Dr. John Lynch is an infectious disease specialist at the University of Washington, UW Medicine. Dr. Lynch, I would say, also want to say, has been incredibly helpful to the Hospital Association throughout the pandemic. He has been our go-to person on many issues and really helping make sure that we are coordinated across the state and have the best information. So thank you very much, Dr. Lynch, for that work. We have Cindy Chase, the Chief Nursing Officer from Ferry County Memorial Hospital in Republic. You all probably know that the current outbreak is really hitting in Republic quite hard, and we'd like to hear what's happening there, including some folks have been airlifted out of the community. A lot of transfers have needed to come out of that community, and we want people to understand how serious it is and to talk about how this can happen in a community if things get really out of control. And then third, we have Renee Resilier-Bomers, who is the Chief Quality Officer from Swedish, and Renee is in charge of the Lumen site, among many other jobs, and is doing a terrific job there, and I think has some great information for us about vaccines. So I'm going to start with some opening comments. The first one is really good news, which is that 2 weeks ago when we spoke with you, we were seeing a really sharp jump in hospitalizations across the state, and that we are still concerned for sure about the level of hospitalizations. We don't like it. It's higher than we would like, but it has not, that acceleration has declined. So we have seen kind of a plateauing of cases, it looks like, across the state. There are some folks, as Dr. Lynch will describe, who have very long stays in the hospital who've had COVID, but it is much better. And we are really grateful to Washingtonians for getting their vaccines, wearing their masks, keeping their distance, working to stop this fourth wave. As we've said repeatedly, the fourth wave is stoppable. It's totally stoppable. We know what behaviors stop it. We need to work together to do it. And it feels like what we're seeing right now, that Washingtonians are responding. We are seeing a plateau of cases. We are not seeing a decline. We want to see a decline. We were at about 350 cases in March for multiple weeks. Even that felt higher than we would like. We're now at about 600 and kind of not going up, but we were at 600 a couple of weeks ago. So we are hopeful to actually see those numbers go down because it's still stress in the system. Dr. Lynch can talk about this as well, but I do want to make sure people know that people who go to the hospital now are still really sick. There's some folks who are younger who do better, who can be in and out and quicker, but we've got plenty of people who have COVID who are really sick or dying. And so this is still not a disease to be trifled with. The second thing I want to talk about is variants. We are continuing to see them grow in our state. We're all worried about what variants may be being generated in other parts of the world. I think we can hear from Dr. Lynch as well about this, but what's happening in India is really scary, and it feels like the possibility that is spawning some serious variants is very much worth watching. And we don't know where they are. We don't know where they're coming from. What we do know is the same behaviors that protect you from the original form of COVID protect you from the variants. And so continuing to do those behaviors of masking and social distancing and vaccinating are the most important things people can do right now. And the third thing we'll talk about, and Renee can really address this, is that vaccines are widely available. And I have discovered something in the last few weeks, which I haven't discovered this, I've heard this, I find really fascinating. I was so eager to get vaccinated. Like, I couldn't get there fast enough when it was my turn. And so I have in my mind that that's how people feel, that they're looking for appointments and trying to get there as quickly as they can. we're finding a lot of folks who are willing to get vaccinated and haven't yet, just because they want to make sure it's convenient and it's easy and they can get there, and they have heard that it's hard. They've heard that you have to spend hours and hours looking for an appointment, or you might have to wait in a long line, or they're concerned it's going to take a lot of effort and time. We're in a place where we said this maybe 2 months ago, that we were going to have a fast flip from too much demand to too much supply. We're now in the too much supply phase. You can get a vaccine anywhere, just about. You can get them at pharmacies, you can get them at sports events, you can get them at community clinics, you can get them at hospitals, you can get them at mass vaccination sites, a lot of places doing walk-ins. And so I really want to get the message out. I think there's so much media coverage of how hard it was to find a vaccine. We would love for there to be media coverage right now of how easy it is to get a vaccine, and to really encourage those folks who are willing to get a vaccine and just haven't gotten around to it, that this is the time to do it, to protect themselves and to protect their community. And the last piece about vaccines, which Dr. Lynch and I are very excited about personally, is that we are expecting that this week kids ages 12 to 15 are going to be authorized to be vaccinated using the Pfizer vaccine. And the reason Dr. Lynch and I are both especially excited about this is we both have 2 kids in this age group. And so my son actually turns 15 next week, and he is thinking about having his birthday event this weekend at a vaccination site, and having it's an outdoor vaccination site. It's across the street from a park. We're going to go to Rainier Beach probably, and we'll go have cupcakes in the park distance after everyone gets their vaccine shot. So I think there's a lot of enthusiasm among young people. It's important, I think, for the community to know that people who have spent all their time in the last year on COVID are really eager to get their kids vaccinated. I think we are both doing it without hesitation. So I want to encourage parents in those age ranges to do the same, and to start thinking about making a plan for their kids to get vaccinated. For my kids, they feel like it's going to change their summer if they and their friends are vaccinated, and they're really excited about that. I'm still going to have them be careful, but I think I'm going to let them do a lot more than I did last summer, to be outside with their friends at the Lake Washington Beach and stuff. So it's really want to encourage parents to be thinking about that plan for their kids. So with that, those opening comments, I'm going to turn to Dr. Lynch to talk about what he's seeing and how he's feeling about his own kids getting vaccinated, and what's the UW experience right now.
Yeah, sure. Thanks, Cassie. I'm just going to flip that around and just pick up where you left off. I have a new 12-year-old and a 14-year-old, both daughters, and I am extremely excited about the potential of vaccination for both of them. If it's available later this week, they're going to get a break from school to get in line for that. We are seeing, vaccine access in parks and other places in our neighborhood. And if it takes walking there and cupcakes after, I'm fully on board. And we've already talked about it, and they're pretty excited as well, because I think Cassie's right. This is going to change the game for them as we think about outdoor activities this summer and other activities. It's really going to, it's really the way forward. I think just moving again, starting back at the beginning around the numbers, within UW medicine facilities, that's UW Medical Center, Montlake and Northwest campuses, Harborview Medical Center and Valley. We have seen a decrease in the number of people with COVID-19 in our facilities right now. At the peak, we're around 60, with a disproportionate number of people at Valley Medical Center, I think reflecting how the epidemic is moving in South King County, in our neck of the woods. The other part, though, is just the number of people requiring critical care who are being transported into our system, particularly here at Harborview Medical Center. We're getting patients from across the state who require ICU level care for their COVID-19 infections, which is keeping our ICU numbers fairly high as a reflection of what's going on around the state. The other thing when we look at that is, even if we look at the numbers of people in our facilities with COVID-19, the teams at each of the facilities are using CDC guidance to move them out of precautions when appropriate, when those patients are no longer infectious. But it's really important to recognize that those folks often still continue to require medical care. So here at Harborview, we're down to about 10 or 11 people who have COVID, still in precautions, who are requiring medical care. But we have almost the same number of people who are still in the hospital, who no longer are infectious, but are still very ill, including 2 people who are on heart-lung bypass machines, these ECMO machines, which is pretty much the highest level of critical care you need. And I know that we're going to be seeing more people today and tomorrow and later this week who require that care for COVID-19 coming from around the state. So in many ways, it feels like, in talking to my colleagues, we may be sort of at the end of the beginning of how we're working through this as we deal with this fourth wave in Washington State. But the impact on the health systems continues to be significant, both with acutely ill COVID patients, but also the continuing care that's needed in all settings. And then lastly, just on the variants part, UW Medicine Clinical Virology continues to do excellent work in surveillance and work with DOH around surveillance. And I can just tell you right now that if you look at all the different variants out there, sort of the wild type background and the variants of concern, the ones, the 1351 from South Africa and P1 from Brazil, the B117, this is the one first described in the UK, is now the most commonly found type of COVID-19 in our state, and certainly in Western Washington as well, and is the one that's, again, more transmissible. So as we think about the utility of vaccination and all the things that Cassie mentioned around masking and distancing, critically important at this juncture to get people immune through vaccination. And until then, following all those non-pharmaceutical interventions like masking, distancing, and staying home when we're ill until we can get to that point of mass vaccination that's going to really drive our numbers down. And hopefully we'll see what will happen here in Washington State, what we see in the UK, what we've seen in Israel, when people really get to that inflection point around vaccination and case counts start dropping dramatically. Thanks, Cassie.
Thank you, Dr. Lynch. And I think one comment that you made is worth noting is that there's been a lot more hospital transfer activity in the last week or so than we've seen for a while, because there's been some outbreaks in communities that are small, that don't have a hospital capacity, that needed to find places, including, and probably most notably, out of Ferry County. So Cindy, with that, I'll introduce you. So Cindy, again, is the Chief Nurse Officer at Ferry County Memorial Health and Republic, which has been the site of some pretty substantial outbreaks. Cindy, you're muted.
It has been a wild ride for the last 4 weeks, just to put it all in perspective. Since last March until this March, we had 76 people that had tested positive. And really, for all of last summer, we had only like 3. And then it kind of started off after October for us. But since April 10th, we have tested 125 positive people out of 630 folks that have been tested. And we have had some really sick people that even up to last Friday, we did have to airlift out a couple of our patients. We've done 9 in the last 3 weeks that had to be airlifted. And unfortunately, we had 2 deaths from there. And it really affects a small community when people are now dying. It's a reality check, because there were folks here that really didn't think that COVID existed, which my understanding is fairly common in rural areas. But it's definitely real now, and we continue to have a steady flow of vaccinations, which is great. And many have said it's really because of the outbreak. It's kind of scared them. And so they opted to go ahead and get vaccinated, which they probably would not have. And even some of our COVID patients who are now out of quarantine are showing up to be vaccinated. If there is a message to be sent really to the community, is that there is no shame in having the virus. We have found hesitance of folks to come in to be tested. And it's sort of, they're not really, I don't think, thinking the whole thing through. If they are infected, they are unknowingly infecting their friends and their families. And nobody knows that they've been exposed. And when they should be quarantining, they're not, which I think is also adding to some of our headaches here. But I'm seeing now that our testing lines are pretty long. We had no COVID over the weekend, which is the first time our poor emergency room has been inundated with COVID patients, which was a little unusual for us. We really hadn't had in our community people who were really sick. Well, that's changing now to where folks are hesitating to even come into the hospital. And so they wait. And because for starters, they don't know that they have COVID because they don't know anybody who had it. And so unknowingly, they were probably infected, and they're coming in late. And when they come here and they've been sick for several days, it's almost like they're having to go on a ventilator right away, which is, it's just a horrible feeling. And we still do have a couple of our patients are still on ventilators. One has been on for over 3 weeks now. And so it's, we're just hoping to get a message out. Get in, get tested. It's okay. We're not going to blab it to everybody around the county that you have COVID, but we need to talk to the people that you've been in contact with. And so I'm hoping that there's going to be a little bit more trust. We're doing what we can with communications to the community to build up that trust. We're doing daily briefings now for the last couple of weeks with just about every facility across Eastern Washington, bringing ideas on how to get out in front of the outbreak, and so many offers to help Ferry County, this small rural hospital in the middle of actually nowhere. I'm really proud of the outpouring of support from our region and really even beyond our region. Hospitals have helped us take some of our patients that were in the hospitals to open up more COVID beds, because it has been a little sticky trying to admit to ICUs over the last week or so. And so we have been trying to prepare in case those patients need to stay here with us. The Department of Health reached out early on and has been paramount in supporting us and the community. They have nurses that are going out and doing home visits to our positive patients and just kind of checking in on them and doing welfare checks. And sometimes they're even doing testing inside their home to the other family members that are there. It's also allowed us to, with their support, to do more contact tracings than faster than if we were just trying to do it on our own. We're kind of a small shop here, and so many people wear many hats, but we just were running out of time to catch people quickly so we can get them tested and get them get them here so they can get tested. Our caregiver staff has been tremendous, as well as our providers. I mentioned a lot of the, COVID patients have been coming through the emergency room, which was really unusual in the last year. We've been able to manage things outside of the hospital, but now people are coming in and they're sicker. And we've tested like over 600 people since this outbreak began on April 10th. And so we are just, we're hanging in there with the help. And we're hoping now that since we didn't have one COVID patient over the weekend, that maybe things are starting to trend in the right direction. Thank you.
Thank you, Cindy. Thanks for sharing that. I'm so sorry to hear about the deaths in your community, and it's sobering, certainly, that has happened. So hope that those others who were airlifted and transferred out are going to recover. But
we hope.
They've got a tough road ahead of them.
Yes, for sure.
All right, Renee, we would love to hear from you about how the vaccine effort is going. And again, if folks on that media on the call have not been to see Lumen, it's really worth seeing. It's super cool. And Renee is very delightful to tour with, so highly recommend it. Go ahead, Renee.
Absolutely. It's definitely been a great experience. So thank you, Cassie, for having me. My name is Renee Rislier-Bomers. I'm the Chief Quality Officer at Swedish Medical Center. And it's just my pleasure to share a little bit more about Swedish's current kind of COVID state of affairs, and also more about Lumen and the vaccination site. So similar to some of the trends that we're seeing nationally and in our community, we are seeing younger and younger patients in our hospitals getting COVID and not being vaccinated. And so This is definitely concerning, so we're still encouraging many communities. If you're 16 and older at this point now, get your vaccine. There's so many opportunities out there. It's really switched, I would say, 2 weeks ago. We had more interest in vaccinations and not enough shots, and now we have enough shots, and we've got a lot of open capacity to bring people in, particularly with Lumen. So we're definitely seeing that shift. So encourage folks to come down, whether it's the mass vac sites or some of the smaller clinics, definitely grocery stores. It's even at sports games now, so super exciting. So operating Lumen Field in conjunction with the city, we're now accepting walk-ups, which is fairly new in the last week and a half. And so prior, we had a wait list of about approximately 120, upwards to 200,000 individuals at any one time waiting for appointments. And so it was purely driven by appointment only. Now we allow for upwards to 200 walk-ins every single hour. There's opportunity just to literally come with your phone, and you can just scan a QR code and we can get you right in. And if folks don't have access to a phone, we do have individuals there who are assisting folks in the moment to get signed up. We're really excited to share that we've been able to vaccinate at Lumen Field alone, in partnership with the city, 85,000 shots of dose 1 and dose 2. We were also honored to have Secretary Bakara come around and tour the other week, which was exciting to really elevate the work that we're doing. Now, as we've discussed, 12 to 15-year-olds, that's our next plan, is how to bring kids into mass vac sites. And my children are 11, 10, and 7. So they're not quite there. But if that age group goes down, I definitely will bring them in for vaccination. But what we're doing now is planning. So once that approval is in place, that we will be able to assist in bringing in families, including 12 to 15-year-olds to Lumen. And so we're working closely with pediatricians, child life specialists, and understanding a process that will ensure that kids feel comfortable getting vaccinated. We know that it's definitely, there's some, growth and development type of challenges. And we will identify a specific pod to help bring our kiddos in for vaccination so that it's a smoother process. So more to come on that, but just know that we have a whole team working at how we can expand Lumen for all age groups that are eligible. Likewise, we're also continuing with much of our mobile efforts with our mobile vans going out into vulnerable areas and communities to help get folks vaccinated. And we're going to start with our third wave of sites. And we're even having some preliminary conversations with schools, understanding how we can work with communities that serve kids in getting access to the vaccinations in a timely manner. Since launching the mobile clinics back in January, we've now administered more than 6,000 vaccines to those populations. And we're really great partners of Cellnetics, T-Mobile, and Denali, and then, of course, working with our union caregivers through SEIU. I also want to do a shout out to all the volunteers. I know that there's many organizations on this phone call and in our community who have had their own caregivers volunteer at Lumen Field. This is not just a Swedish-only event in partnership with the city. It really has been a reflection of the entirety of the community. Nurses coming from all walks of life backgrounds, public health nurses, nurses from Harborview, UW, Virginia Mason, others. I can't even go through the list. And so if it wasn't for them, we would never have been able to achieve the 85,000 plus that we've been able to do these past months. A plug out, if folks are still interested in volunteering, we've always been interested to see when that volunteer fatigue is hitting, and it's starting to hit. Folks are getting tired, and so we're definitely looking for folks to kind of expand into other care areas to help and support, particularly with dentistry and veterinarians have been crucial. We do have our site, www.communityvaccination.org. And so folks can definitely sign up if they have any availability and interest. And then I guess my biggest other plug is, other than get vaccinated, just keep up what you're doing, washing your hands, social distancing, masking. Just keep up those efforts as we watch that trajectory of those numbers. Again, they're not all in the ICU. We're not seeing the high acuities, but we have young folks coming in and suffering from this disease process, and it still is requiring hospitalizations. And our numbers for Swedish have waxed and waned between 30 upwards to the high 40s. And so we still haven't seen that large dip that we're looking forward to. So continue up those efforts. Thanks, Casey.
Thank you very much. All right, now we'll go to Q&A, and we've got a number of questions in the chat. There is an interest in talking, Dr. Lynch, with you about the variants. And Allison, looks like you have both Glenn Farley and Allison Grande look like you've got questions about it. So the question, one of the questions is, there's a new report from UW researchers about yet another new variant, and what do you know about that, and what's your concern level?
Yeah, I'm sorry. I actually just did a quick search on that. I haven't heard about a UW clinical virology report on new variants, unless they were referring to the potential variant of concern coming out of India. I would say overall that the variants of concern, most importantly the B.1.1.7 and variants coming out of California, are now the predominant strains that are being sequenced here. There's still some of this sort of wild type COVID-19 or SARS-CoV-2 in the background, but the vast majority of infections now are being caused by variants of concern, with B.1.1.7 leading the way.
And I think it's important for people to know that what gives the variants a chance to vary, or gives the disease a chance to vary, is having more hosts. So the more people who get COVID, the more chance there is for variants to be spawned and spread, and we do not want them. So this is, again, back to the, what does it take to stop this disease? Having people not get COVID helps to keep down the variants. So we really want people to, again, vaccinate, wear their masks, et cetera.
Yeah.
Allison, you had a question you wanted to ask?
I did. Did Dr. Lynch want to finish what he was saying? I think he was.
Oh, sorry.
No, I was going to just follow up with what Cassie said. We've done a really good job in Washington State with keeping COVID, numbers overall low compared to many other states in the country. And that means that most of the people in Washington State are not immune. And so that's really why the things like masking and distancing and vaccination are so important for our state, and why we're to some extent sort of vulnerable if we back off on those measures.
Okay, Allison, go ahead.
Thank you so much. Dr. Lynch, I wouldn't expect you to comment directly on this, but just kind of what's happening here. There's an outbreak at a nursing home up in Whatcom County, and there are 19 cases there between residents and workers. 6 could be breakthrough cases. They were fully vaccinated people. It's still being investigated. But tell us about how rare breakthrough cases are, how they're doing routine testing in places like nursing homes so they might catch them, but also how important it is to vaccinate for healthcare workers of all levels and all places to get vaccinated so they don't bring it in.
Yeah, this is a great question and a really important topic. So, I think you actually hit on most of it. So, healthcare worker vaccination rates are critically important. And Cindy should also comment on this in her experience in Ferry County. We're seeing a wide variation in healthcare worker acceptance around vaccination for various reasons. And that's in all different healthcare settings, right? Going from residential settings like long-term care facilities and skilled nurse facilities to acute care hospitals of all types. And different roles are engaging in vaccination in different levels. And so getting healthcare workers vaccinated is critically important to keep them safe, right? We really want healthcare workers to be safe. We want their families to be safe, given everything they've done over this last year. We want patients to be safe. We want visitors to be safe, and so forth. So the challenge think of it this way. If you take a fully vaccinated person, we know these vaccines are amazing in terms of their ability to basically prevent death, prevent serious illness. And I say serious illness, I mean basically anyone who needs even oxygen level, not just ICU or critical care, but any type of serious illness. Fantastic vaccines. But they're not, no vaccine is perfect, and people can still, at a very low rate, get infected, often asymptomatically, sometimes with minor symptoms. But just think about the risk of that happening. If you have a vaccinated person who's sort of dropped into a bucket of people who are essentially unvaccinated and COVID circulating, that risk is going to be higher than if you take that person who's vaccinated and drop them into a bucket of mostly vaccinated people. And so the big issue is in places like skilled nursing facilities, and we know this from other vaccine work. We know these vaccines work really well in older adults or elders, but we know that as we get older, our immune responses aren't as potent as they are when we're younger. And so what we're maybe seeing, we've seen a few reports like the one you just described in long-term care facilities where we are seeing someone who's unvaccinated come into a setting where there's older adults who are vaccinated. We're seeing some cases arise out of that. And it's probably a combination of lots of things. Maybe the variants of concern, like B117, that are more easily transmissible. A group of older adults, some of whom may be immunosuppressed because of their age or because of medications, and they're vaccinated. The good news that we're hearing out of those is even though we are seeing cases occurring, the vast majority of those cases are minimally symptomatic or asymptomatic. And the issue with asymptomatic issue, as you mentioned, was if you are doing screening within one of these facilities regularly, repeatedly, and we're seeing this in healthcare settings as well, where we're doing testing for people, for after exposures or before getting a procedure, that they may be positive and have no symptoms at all. And so basically signaling the vaccines are working extremely well in reducing asymptomatic infections. And for those folks who do get infected with symptoms, have very minimal symptoms. But unfortunately, as we've seen in some of the other outbreaks in the United States, where this happens, is that if this happens enough, some people who are vaccinated who do get infected in these settings may get sick. And in fact, as we've seen in one outbreak in the United States, may die as a result. So much better situation than we were dealing with a year ago. I mean, dramatically, logarithmically better, but still a risky situation where, again, we need more people vaccinated to reduce that transmission. Sorry, a complicated question with a long answer, sorry.
Thank you. Renee, I see you put in the chat the response about kids, but maybe you could talk that through a bit as well. And having been the parent of children who actually, when they got their flu shots, like someone was amputating their arms without anesthesia, I totally understand the fear of needles. Interestingly, actually, I will say that from a parent point of view, my kids hate their vaccines. They hate them. They get mad every time they have a checkup. They need vaccines. They want to get this vaccine. This is the first time they've been like, when can I go? When can I go? Because they want to go do stuff.
Actually, that's really funny because as a mother who's had to put her children in probably a full Nelson in order to get their flu vaccine, and to have my kids come up to me and say, "Hey, when do I get my COVID vaccine?" like you, it's actually quite compelling. So when we talk about challenges in vaccinating kids, there's, the considerations of just age developmental interventions, distraction, and other, methods to make it more comfortable. And if you can imagine, especially in a mass vaccination site where you've got hundreds of people coming into an area, there's a lot of noise. We need to think of strategies of how to distract. We also don't want, folks coming in, finding kids in distress, getting their vaccinations, and that also not being a pleasant experience for the children who are waiting to go through that process. And so we're putting a lot of concerted efforts working with pediatricians, child life specialists, pediatric nurses on some of the strategies to make it a bit easier. Now, fortunately, with 16 plus, we haven't had to do much intervention. Many 16-year-olds, many adults are fearful of vaccination, but they are able to consent and respond in a different manner than 12-year-olds. And especially if we see that age group go down to 6, 7, 8-year-olds, just employing a few other different interventions to make it a little bit more comfortable, having a private pod to do it versus out in the general public. And then again, the explanations that we provide to kiddos tend to be a little bit different, but we are also educating and consenting through the guardian or through the parent. And so making sure that we're able to answer the questions that parents might have related to the EUA, its coverage for kids. So we have to train up our medical providers who will be answering those questions to be able to just assuage the things that will come through, I know any parent would have when they're consenting to a procedure.
Thank you. Dr. Lynch, another question for you. What do you think what are you learning about natural immunity and how long it lasts, and how long should someone who had COVID wait before getting the vaccine? And then would variants play a role in how long that natural immunity might last?
Yeah, so we're still learning about the duration of natural immunity. I think some of this, we just think about the variants that are circulating right now. There's very good data from both what the antibody testing and also some more, research level testing on what are called the cellular immune response. This is the kind of the long lasting part of our immune system, showing that these vaccines immune responses continue to persist quite far into the future. But again, we've only been doing vaccination, now for about 7 months, 8 months in regular population. So we still have a ways to go to learn more. I think that the idea of annual vaccination is still on the table. Whether we call that a booster or we think of it annually, like we think about flu vaccine, remains to be open. Right now in the United States, again, remember, the vaccines that we're using are very effective against the variants that I just talked about. So the B117, the P1, the California variants, and so forth. These vaccines still work extremely well. What we really have to also grapple with as we go forward is thinking about what Cassie mentioned around other variants. So if we have largely non-immune populations where coronavirus continues to circulate, variants will occur. This may happen in specific communities, but it may happen in other parts of the world. And we know, as we've learned, all of us in the last year, these variants can travel very rapidly and then lead to exposures and transmission pretty much everywhere in the world in a short period of time. So, is it theoretically possible that a variant could arise out there that would get past the vaccine-mediated immunity? I certainly think it's a theoretical concern that and why we need to get to sort of a global vaccine access to protect all of us going forward. You asked the second part, Cassie, and I forgot what the question was.
I think you answered it. Could variants play a role in how long natural immunity could last? It sounds like,
yeah,
possibly, yeah.
We don't know just yet. It is very reasonable to think about annual vaccination, but right now, all the data. Oh, I know you did ask how soon after having COVID. So as soon as you're out of your isolation, that means that, if you have COVID-19, you're at home, you have symptoms, you should be isolated for 10 days. As soon as that time period is over, you can get vaccinated, right? There's no problems with doing that. It keeps the healthcare workers who are doing the vaccinations safe and everyone at the vaccine facility. One really important take home that is about this is that we are learning that the vaccine-mediated immunity is better, is more potent than the immunity through natural infection. So even if you've had COVID, getting vaccinated is still really important and may lead to more broad and long-lasting immunity. So that question around, can you get COVID after getting vaccinated or after getting COVID itself? I think vaccination is really the way forward, even for people who've had the infection.
Thank you.
I can add actually to that as well. We are vaccinating COVID patients after they have finished their quarantine, 10 to 14 days, and they have to be asymptomatic. But if they've had any type of antibody therapy, that pushes it out to 90 days. And the reasoning behind that is they get this antibody therapy. They don't want a response from the COVID vaccine to interfere with the response of the antibodies. So we do have them wait for 90 days. I believe that's a CDC requirement or guideline.
Thanks. Thank you, Cindy. And Cindy, there's a question for you, which is, are you able to continue vaccination efforts in Republic when your staff are so stretched with testing and patient care?
Yes, we can. Our vaccine program actually is very alive and well, and we do have some volunteer nurses who come and help with vaccine. But recently, WSU has reached out to us and are volunteering to come and take. They have a van. In fact, it's parked here that they can drive to areas maybe further out in the county where it's harder to come in, and they will start setting up some vaccines. So a little bit further away, 40, 50 miles away, they'll be able to set up and do vaccines there. And they're actually coming tomorrow to participate in our vaccine clinic tomorrow. We have a drive-through vaccination, which is really, it's kind of a cool, we call it the COVID village, where people could drive through and get their vaccine. And then on the other side, we were doing testing before April hit, and we now do it out in the front of our hospital, another drive-through testing site. So the lab has really been the most stretched because they have to collect it and then run the tests. And then if we're getting close to running out of tests, then we have to send them out to Spokane to be processed there. But no, our vaccine efforts are great. We do at least 100 to 200 a week. And so we're well over 3,000 vaccines since we started here. Our town is about 1,200 people and probably about 5,000 countywide. So we are doing great in that regard. That was a great question. Thank you.
Thank you. Dr. Lynch, another question for you. How vulnerable are vaccinated immunocompromised people and why?
Yeah, this is a rapidly progressing field. So we're getting more and more information around this. There's been a handful of research reports now showing that people who have had solid organ transplants, so people who had a kidney transplant or a liver transplant, that the vaccines aren't nearly as effective for those individuals. And so experts in that area are recommending, vaccination for them. They should definitely get vaccinated, as should anybody without a distinct medical contraindication, but that they should continue to be wearing masks and similar. When we look at people who've had a bone marrow transplant, we're starting to learn similar things. People getting chemotherapy. We always worry about these with all kinds of infectious diseases, and it's proving true, unfortunately, for coronavirus as well. And so the issue isn't that they shouldn't get vaccinated. They absolutely should. These vaccines are very safe for people who have had a liver transplant or a heart transplant, people who have cancer or similar. The issue is how good is the immune response as a result of that vaccination. And so what the real push, as I mentioned, is not only, are they still going to be focusing on things like masking, but they're relying on all of us whose immune systems do work to get vaccinated. And this is true, again, for things like flu and other vaccines. The only way to keep them safe, they can get vaccinated over and over and over again, and it's not going to have the same impact as if everyone in their family gets vaccinated, everyone who's a close contact who gets vaccinated, everyone in their community. Because it's only when that happens will they be free at some point in the future to take their masks off and not be worried about getting COVID-19. So no barrier to them getting vaccinated. The problem is how well that vaccine works. And really importantly, going back to how important vaccination is, they're counting on us to get vaccinated, those of us with intact immune systems, to keep them safe.
Thank you. All right, we have some questions about hospitalization rates and how that lines up with the state's data dashboards. I wanted to share my screen, but it doesn't look like I can. Brian, can you give me screen sharing possibilities? And I'll just tell you what's on the dashboard. So there's the state has two data dashboards. Brian, let me know if I can do that. Oh no, I got it. Okay, great. Okay. The state has two data dashboards. So one, can folks see that?
Yes.
Yeah.
Yes.
Okay. So this is the data dashboard that's on the DOH site, and it is a rolling. I think it presents a rolling 7-day average. And so the question was, it looks like hospitalizations are really increasing, but the last date of data input here looks like it was the 27th of April, and it was showing an increase. We look at the WaHealth data as well, and this is the governor's roadmap to recovery. And so here you actually do, this data is newer, it's through the 6th, and you see this plateau in here starting to happen from a pretty sharp increase. So that's what we're seeing. It's just the new plateau. And the other place that we look a lot is this COVID-like illness hospitalizations. So this is the people that look like they might have COVID right when they're coming into the ER. And you can see that those are starting to decline as well. So that's the plateau that we're talking about. Dr. Lynch, do you have or anybody else have comments on the dashboard? I know you all look at the data a lot as well, but that's what when we say the case they're plateauing, that's what we're seeing.
You covered it perfectly, Cassie.
Okay. Great. So I recommend looking at all those dashboards, the governor's and the DOH one as well. Okay. How has the lessening demand affected vaccine ordering at our hospitals? And are we expecting demand to pick up once the 12 to 15 age group becomes eligible? So anybody, Renee, you want to take that?
Yeah. So we're watching it pretty carefully. So for the hospitals, what we're doing is we're working in identifying, just tracking percentage of no-shows, percentage of walk-ins, and how many appointments we have. We do anticipate that once the 12 to 15-year-old folks are approved, that we'll see an increase in that number. So we do our ordering every single week, and so we're meeting 3 times a week in order to adjust and to project forward what we anticipate, not overshooting so we have mass volumes of unused vaccinations, but also ensuring that we have enough so that when folks are walking in and having that demand, we're able to meet those expectations. So we're watching it pretty closely every single week. We are anticipating some growth with the 12 to 15-year-olds. We're also doing a lot more marketing to try and tap into the folks who have been hesitant. So though we've plateaued and gone down in relation to appointments, we are trying to do some more marketing to make it easy so folks feel more comfortable coming in and getting their shot.
Thanks, Renee. Is there any advantage to fully vaccinated folks getting a different vaccine, doubling up? Like if you got, I guess this question is like, if you finish Pfizer, should you go get J&J? I have not heard this question. Actually, I don't know.
No, there's as of right now, there are no data on that. I think some places, some research groups are looking at mix and match. So, if you got Pfizer and then you got a Moderna or the other way around, or you got a Pfizer and a J&J. And I think to some extent, just to understand what that is. And we know that, in the world that has happened. And so being able to give people good answers around that are important. But as of right now, no recommendations for mixing and matching or adding a vaccine. These, as I said, the vaccine data is astounding. I mean, way better than we ever hoped for in terms of their ability to prevent illness and death. So no need to, get a full vaccine and then do it again.
And something Dr. Lynch said earlier that I forgot to comment on that I think is really interesting about vaccine. Some healthcare workers not having received their vaccines, a very interesting subgroup of healthcare workers who are largely totally getting their, 100% of getting vaccine or very close to it, are people who've cared for people with COVID. That group wants the vaccine. They've seen how bad it is, and we're saying that's the highest take up. And I don't know if any of you want to comment on that, but that's, if you've seen how sick people get, you don't want to get this disease.
That's part of what we are seeing now here in Ferry County. I mean, we've just been kind of, going with the flow here for the last year because we haven't had very many cases. And now that things are starting to pick up, the staff is taking notice. And our administration actually threw in a little added incentive that for those who have been fully vaccinated are receiving a $500 bonus. And since that has come out, I think we've had like about 7 staff people who have come forward saying that they want it. And it's probably, we're having to bribe them to do it. But, we have a long-term care unit right attached to our acute care unit. So it is really vitally important for us to be sure that everybody gets vaccinated. But that's what we've tried. And so we've done I think we're about 66% of our staff has been vaccinated here between our clinic and the hospital staff. So we're just trying to get that boosted up. And so we'll see how that is, what the staff say about that. And if they'll start, no one has griped that's saying, oh, they're forcing us to get vaccinated or they're trying to make us do it. And nobody has said anything. So I think they're chewing on it a little bit to see if this is, if they're really, if they're going to do it or not. I hope they do. I just worry about our long-term care patients that are just so close in proximity. So far we've been able to keep everybody safe in our hospital, but it would be nice to have more of the aides and the nurses get vaccinated.
This is John Lynch at UW Medicine, and it's been we're just a bit over 80%, sort of in the 80% range for clinical folks getting vaccinated. But it's been taking some work to figure out how to close that gap. And when I talk to colleagues across the state, I definitely think that, having the experience, a personal experience around COVID is a driver for some folks, but it's not necessarily the only thing that's needed. It seems like other folks still are thinking about it, needing an opportunity to talk to a trusted community person, a leader, a primary care provider, or similar. And I just ask people to try to do that. If you have questions, please reach out to someone you trust who is knowledgeable. Talk to your primary care provider, talk to a public health official, and try to get those questions answered, because we really do want, I know Renee wants as many people vaccinated and going through Lumen Field as possible and all the other sites. We have the opportunity here, but we can't let people sort of sit back. We're going to continue to try to push out in those communities, but if you have any questions, please, people should be messaging. There are people who want to answer those. And that includes the need to get healthcare workers more vaccinated. We are seeing some areas where it's much, much lower, 30, 40% of healthcare workers. And that's, for a vaccine that's extremely effective, very safe for a dangerous disease. That's kind of the trifecta, right? And it keeps patients and healthcare workers safe.
Thank you. A question about nurse shortage, whether we're in a nurse shortage in Washington State and possible causes of that. We have been in kind of a perpetual nurse shortage in Washington State for a very long time. I think there's a nurse shortage across the country, actually. We continue to call on the state legislature to make more investments in nurse education, to hire more nurse faculty, create more nurse training spots. All the nursing schools in the state turn away highly qualified candidates for their programs every year. We also are hampered by not being part of the National Nurse Compact, which is an interstate compact that allows nurses to practice across state lines. We're one of few states not in it. And that really makes people not want to come here, because it's a lot harder to come here to work than it is if you're in a compact state. You've been licensed in a compact state, you can move to a compact state, get right to work. You don't have to go through a separate licensing process.
That's definitely been an issue, like out here in Ferry County. Like I said, we're out in the middle of nowhere, and it is hard to recruit for people to come. But part of that was it was a lot of work to get licensed in Washington State if they weren't previously here. So apparently they've kind of made it a little easier for out-of-state nurses to get licensed a lot faster, because we're sitting here, we need them. But the licensing process was just so onerous. It was taking forever, but that has gotten better. And our staffing here, I mean, it's not bad. We're only really probably just a couple of nurses away of being completely fully staffed. So we're getting there.
And just to clarify, the licensing has gotten better because of emergency funding because of the pandemic. Once that emergency funding is gone, we're going to go back and even still we're at a disadvantage because people still have to, there's still a process people have to go through that they don't have to go through in other states. But once that emergency funding is gone, it's going to be back to being a huge disadvantage for us. Do we feel like we are at an inflection point to the positive now that we have so many people vaccinated? It's around 40% for full vaccination, higher for single doses, despite the stubborn hospitalization levels. Is it unlikely to get worse? Dr. Lynch, what are your thoughts about that? My thought is I hope so, but that always makes me nervous to answer that way because I don't know.
It's a really hard question to answer. When you look at the numbers as much as all of us do, as I do every single day, and have been doing this since last February, and you look at those vaccine numbers, I can't help but think that they are linked, right? That they are associated. And we've seen the impact of vaccinations in other countries and other communities. We're seeing what's happening around the United States and vaccine rates. If you look at the CDC numbers overall, we are sort of in an exponential decay in terms of the number of new cases, which is fantastic. And so, yes, I think that we are probably at that inflection point where we see that look at the cases, particularly in my county, King County, we look at the number of hospitalizations, we look at the number of deaths, which remained very low through this fourth surge, that I think we'd be looking at potentially our last big surge if things stay the same, right, in terms of variants and other activities. And so, yeah, I can't think of other things that would be impacting that right now, given, being in phase 3 or phase 2, depending upon where you are in the state. So, yeah, the short answer is yes. I think we are at an inflection point. And only the next few weeks will really tell us what's the facts.
And if you want to be helpful in accelerating that inflection point to the positive, go get your vaccine. And that's the bottom line message here. Another question about there's an earlier question about, do we think kids should be vaccinated for return to school in the fall? We have not discussed that at the Hospital Association yet. I'm excited my kids are back to school. Anybody have an opinion about that? I think we're going to talk to our public health colleagues about that. Interesting that both UW and WSU have now announced it as a requirement, but it is not, we haven't gotten to that yet since we don't even have vaccine available yet to most school kids.
I think the governor's
last question. Yeah. Last question is, the parent of a 12-year-old, is there anywhere you've seen that we can sign up for appointments now? I don't think that the appointments are open since no one knows the exact date that the approval will be granted. So I think the moment the FDA says the approval will be granted, there'll be appointments available. And it sounds like Lumen will be a place to go. I'm thinking I'm going to go to the Rainier Beach site, it's close to my house. But I think there should be good availability once the announcement is made.
I know Renee.
Many sites are already talking about it. So once we get the approval, that we can spring forward versus waiting for the approval and then figuring it out. So we're already doing advanced planning. We're looking at family days. You can get your vaccine, bring your kids, they can get vaccinated too. So we will likely be able to publicize and market days pretty quickly once we get the thumbs up.
UW Medicine's vaccine teams are doing the exact same thing as Renee's. They've actually been planning for this for weeks, and we'll be ready to go. And I know just through anecdotes from colleagues that they're getting messages from their pediatricians, and have been for the last week or two, saying, hey, this is coming down. We're going to clear the docket. Get ready. Be prepared to pull your kids out of school and come and get vaccinated. So The messages are definitely circulating, and the prep work's being done.
Great. And then the last question, have any of the airlifted patients from Republic come to Harborview? I know one went to Swedish. Anybody?
One went to Swedish. Most have gone to Spokane. I think we had a patient at Moses Lake. So it's kind of all around the area here, utilizing hospitals that we normally would not use, but the hospitals in Spokane have been pretty tight. So
yeah, I know that I can check with my Harborview colleagues who are on the call about whether we have folks from airlifted here at Republic, where we're seeing a really tight. So when you think about hospitalizations, I talked about this earlier. So when people are in the hospital, kind of regular hospitalization, that's acute care, and then there's ICU, which is also called critical care. The very sickest people in critical care need these heart-lung bypass machines, also called ECMO or ECLS. You may have heard of that. Over this last year, we've had an unprecedented number of people needing that level of critical care, and that access is extremely limited. Swedish has the ability to do a few of these cases, UWMC, Montlake, Sacred Heart, and Harborview, I think, in our state. And beyond that, then you have to go out to Oregon. Basically, you're moving down to Portland. And this resource is very, very limited. It requires special training, special machines, and a lot of resources. And you just sort of see, we have acute care beds that are needed by COVID patients. The proportion of ICU patients needed with COVID is even higher. And then you look at ECMO, it's just, I've never seen this many people requiring that level of the highest level of critical care. And we need that also for people who have unfortunate accidents, trauma, other serious infections like pneumonia, drownings, near drownings. These are extremely important life-saving measures for those folks. But the number of people requiring that of COVID is just we've never seen this level before. I saw Renee nodding as well. And so when people need that care, there's very limited places they're coming, and Harborview is definitely one of them. At one point, I think we had 5 people on this machine, and usually we have 1 or 2. I think Swedish has been in a similar boat.
We have, and in fact, we were talking about nursing shortages. The nurses needed for ECMO training and such. I mean, we've had to do a lot of work in getting those nurses in and cross-trained.
So in conclusion, don't get COVID. Get your vaccine, wear your mask, keep your distance. You do not want to have to need this level of care. And if you want, we've said this a bunch of times, people want to support healthcare workers. The best way to support your healthcare workers is to not get COVID and not have them have to take care of you when you're this sick. So thank you again for joining us today. Thank you to Dr. Lynch, Cindy, and Renee. Really appreciate you being here today and your tremendous work throughout this pandemic. We hope we get to stop talking about it. It's the question of, are we at an inflection point? We hope we get to stop talking about this sometime soon. Take care, everybody. Bye.